The hands are one of the most highly exposed areas on the body to solar damage or sun damage. And most people, unfortunately, forget to put sunblock on their hands. They'll remember their faces, they'll wear hats. Makeup in itself can have some sunscreen effect, but the hands are often neglected, and even when sunscreen is applied, it is easily washed or wiped off. Therefore, over time, the skin on the hands gets very thinned and damaged because of sun, particularly in our Australian climate. This results in a thinning of the skin with loss of collagen and elastin fibers, a disordering of the collagen so that you get a lumpiness in the texture and a dullness on the surface. It can also result in the formation of solar lentigos, sometimes known as age spots or liver spots sometimes on the hands. And so a lot of this is due to solar damage. The normal aging process also causes a reduction in the thickness and the elasticity of the skin as well, and this is accelerated by sun damage. So they're the main things that happen. There's also a loss of the subcutaneous tissue underneath the skin, and so you get a skeletalization of the hands, whereby the tendons and bony structures, deeper structures, become more visible underneath. And so they're the major effects that happen. Age spots are usually one of two things, either what we call seborrheic keratoses or aging warts, which are a purely age-related thin warty growth that can occur basically anywhere in the body. Often occurs in areas where there is friction on the body, such as areas where the underwear rubs, around bra straps, those type of areas. Then also we get areas of pigmentation form in sun-exposed areas, and these are usually what we call solar lentigos, which are areas of sun-induced pigmentation, and they particularly affect areas like the hands and the arms, the lower legs and the sides of the face. And these are very much a sun-related form of age spot. So they're not strictly an age spot, but they occur in the skin as people age in the sun. Wearing sunscreen, once again, on the heavily exposed areas such as the face, the neck and chest and the hands is the first line of treatment for sunspots. Various creams can be used to fade or to reduce the severity of these, but the effects from these will be fairly minimal and will require quite a lot of time to develop. Chemical peels can be used to remove the surface layers of the skin, and for certain types of age spots they can work quite well. And then there are various laser therapies that can be used to remove age spots. If the spot is brown or darkly coloured, then a pigment laser can be very effective in removing it. If the spots are thicker and more warty, then it's sometimes necessary to vaporize them away with a resurfacing laser, and in which case we would put local anesthetic under each lesion and vaporize it off the surface of the skin. So there are many ways to remove age spots, just depending on where they are, how thick they are, what color they are, and what kind of result we're trying to achieve. There's a couple of things we can do for hands. If there is significant volume loss underneath the skin and skeletalization, then dermal fillers can be put underneath the skin of the hands to add some padding and hide the deeper structures. And so that's one of the first ways that we can rejuvenate the hands. If there are significant age spots, as in discrete brown areas on the hands, and these are the major cosmetic problem, then these can be treated individually with a pigment laser and removed. But to actually improve the quality of the skin on the hands, we would normally use laser resurfacing or fractionated laser resurfacing, and sometimes a combination of that with platelet-rich plasma, which is, I think, what we're going to do this afternoon. With you. So in that situation, what we would look at doing is injecting some platelet-rich plasma into the skin of the hands, and then using a fractionated CO2 laser to then cause multiple tiny little wounds over the surface of the skin, which then the body will heal, and heal very well because of the platelet-rich plasma. So in that situation, what the laser is doing, it's removing tiny little spots of skin from the surface, and then because it's heating the surrounding skin around each spot, it's stimulating collagen production in the surrounding areas. So we're partially removing the sun-damaged surface, and then we're stimulating the growth of new collagen fibers underneath to thicken the skin up. Normally we would look at doing 2 to 3 treatments on the hands, spaced somewhere approximately 1 to 2 months apart, and then it may be necessary to do a top-up treatment anywhere between 1 and 2 or 3 years after the treatment. Fractionated laser is inherently very safe because it is fractionated, and most of the time on the hands we would be removing somewhere between 10 and 20% of the skin surface. What that means is that we're leaving somewhere between 80 and 90% of the skin surface intact. So the skin is more robust and less fragile than it would initially seem. The most important thing after any form of laser resurfacing is to keep the skin moist, and this can be done using several different things. Vaseline is the mainstay of aftercare after skin laser resurfacing, but more recently I've been using a silicon-based treatment called Stratamed, which is easier to use than Vaseline and improves the barrier function of the skin. So in that situation, after lasering, we would then apply some platelet-rich plasma topically to the laser burns. We would let that dry on the skin, and then we would cover that with a silicone dressing or silicone ointment. I then usually give the patient a tube of the silicone to take home with them, and they can apply that 2 to 3 times a day for the next few days. The skin will then bronze up, and over about 4 or 5 days form a kind of slightly rough surface, which will then begin to peel off about 4 to 5 days after the treatment. The peeling process then takes about 2 or 3 days, so at the end of a week the skin has peeled, and at that stage it's very smooth but still quite pink and healing. After any form of laser treatment, there are 4 phases to the healing process. The first phase is hemostasis, which is the sealing over of the small laser wounds, and this typically takes anywhere from 2 to 4 or 5 days. The next stage of the healing process is the settling or resolving inflammatory phase, which is the settling of the redness in the skin, and that takes anywhere from about 2 to 4 weeks to settle down. It's only after that period of time that we actually get neocollagenesis or new collagen formation. And that process starts, as I say, about 3 to 4 weeks after the treatment and then continues for many months. Initially, that collagen is laid down in a fairly random and disorganized way, but then the 4th phase of healing is collagen remodeling, and this starts somewhere around 1 to 2 months after the treatment. So the initial random collagen that's been laid down is partially resorbed and relaid down in a more basket-like, more solid, compact, denser form. And this process goes on for many months. So the maximum effect after a laser resurfacing treatment would be at approximately 6 months after the treatment, not 6 weeks or 6 days.